My name is Carolyn Larsen. I am one of the cardiologists that works in the cardio-oncology clinic in Mayo, Arizona. So I'm going to start off the afternoon going over a review of some key topics in cardio-oncology. This is a actually quite broad field that applies probably to a lot of patients that you see. So I'll try to do as much of a review as I can in 25 minutes. But if you end up feeling like I don't go into enough detail or depth as you might want to hear on some topics, I would encourage you to look into our cardio-oncology course as well, which is several days just on this topic. But the objectives for this afternoon will be first to help you identify which cancer patients are at highest risk of having cardiovascular complications related to the cancer therapies they have received. Then we'll review some expert consensus recommendations on how you monitor these high-risk patients during and after their chemotherapy. And then we'll also review the cardiotoxicity of some other therapies you might commonly see patients on that maybe weren't covered in these expert consensus recommendations, including kind of the hot topic in cardio-oncology right now, the immune checkpoint inhibitors. By way of introduction and just kind of encouraging you to recognize how common issues in cardio-oncology really are, I wanted to point out that, as many of you know, cancer and cardiovascular disease are the leading causes of death in adults in the United States over the age of 45. And interestingly, we all probably know this but don't really think about it a lot, they share many of the same risk factors, and many of those risk factors are modifiable. And that's important for two reasons. One is that many of your cancer patients will be at high risk for developing cardiac disease, but also many of your cardiac patients are at increased risk of cancer. I guess the other side of that coin, though, is it's a very important area or opportunity for prevention when you encourage your patients to develop kind of healthy lifestyles with exercise, maintaining a normal weight, eating a healthy diet, not smoking. You're not only helping them prevent cardiovascular disease, but also cancer. So without further ado, the American Society of Clinical Oncology has published guidelines on how we define who is at increased risk of cardiovascular disease related to their cancer treatment. The first group is patients who have received high-dose anthracyclines, and we'll talk in more detail about anthracyclines in upcoming slides. Also patients who have received high-dose radiation therapy where the heart is near the treatment field. Or patients who have received a combination of both of those, even if it's at lower doses. And lastly, patients who have received a lower dose of an anthracycline but then go on to get trastuzumab. And these are all therapies that we'll be talking about in upcoming slides. They also go on to define one other potentially higher risk group, and that's patients who either receive trastuzumab alone or a lower dose of anthracycline alone, but they have other risk factors. And that can either be traditional cardiovascular risk factors,